Hello and welcome to Diagnosis Bona Corazza Bona. And today's topic is diseases of the gallbladder and biliary tree. And of course, sometimes this disease is quite confusing because they have quite similar names and symptoms, but anyway, the causes are different, and I hope this video will help you to understand it. And so let's get started. Okay, so the first one is Coli Cystitis. It's when there are gallstones in the gallbladder, and it's usually asymptomatic, and it becomes symptomatic is just for 2% patients per year. And what symptoms could be? It's a colicky pain in right upper quadrant, which works with a fatty food. So there is a special name for this diagnosis. It's a right upper quadrant ultrasound, and you will see acoustic shadowing. It's this like a dark shadow under this gallstone. Okay, next is treatment. If it's asymptomatic, usually treatment there is no treatment. But if it's a large stone that more than 3 centimeter, and or it's a porcelain gallbladder, so it's when this porcelain gallbladder, when the wall of this gallstone is like a stone, very hard. And also, so if it's asymptomatic, okay, it will be cholecystectomy. Also, there are two types of gallstones. It's cholesterol gallstones and pigmented. And if it's a cholesterol gallstones, you can also use ursodeoxycholic acid or also extracorporeal shockwave lithotripsy. Okay, next condition is a Coli Cystitis, and it's like a consequence of the previous condition, and it's an inflammation of the gallbladder, and it's usually caused by gallstones. And what bacteria will cause it? It's due to E. coli, Klebsiella species, and Enterococcus faecalis. Symptoms are fever, steady severe pain and tenderness. Also positive Murphy sign. It means it's a pain on palpation in the right upper quadrant with cessation on inspiration. So when you palpate gallbladder of this patient will feel pain, and he or she will stop breathing at this moment. So diagnosis, again, it's a right upper quadrant ultrasound, and also there is a special diagnostic method for Coli Cystitis. It's a HIDA scan, or also use CT scan, because this Coli Cystitis could be caused by cancer too. So, and treatment, so management includes IV fluids and needle by mouth, also analgesics and opiate to relieve pain, and of course intensive course of antibiotics. And next you just monitor this patient, and if you see that symptoms worse, and and it means that next step will be cholecystectomy. Next is Colidocalysis. It's when there is gallstones in the common bile duct, and symptoms will be abdominal pain in the right upper quadrant. Also, it could be jaundice and dark urine and pale stool, and also it could be some abnormalities in the blood, and like elevated alkaline phosphatase and transaminase, but just mild. And also there is a way to diagnose and treat this condition. It's ERCP, and you will see dilated hepatic bile ducts and like this, and also there is this the gallstone and dilated hepatic bile duct. Okay, so and next is cholangitis. It's also like consequences of the Colidocalysis, and there is even special name for these symptoms. It's a Charcot's triad. It's a fever, right upper quadrant pain, jaundice, and if you add two more symptoms, alterated mental status and hypertension, it will be Raynaud's pentad. So diagnosis, you'll see leukocytosis, hyperbilirubinemia, elevated alkaline phosphatase, also elevated gamma-glutamyl transpeptidase, and also aspartate and alanine transaminase, and also elevated serum amylase level. And so you have to do ultrasound or ERCP, which will be treatment too. So the initial treatment is will be aggressive fluid resuscitation and intravenous antibiotics, and followed by biliary decompression. And the most appropriate method of biliary decompression is ERCP with sphincterectomy and stenting. So okay, and the last two conditions are primary biliary cirrhosis and primary sclerosing cholangitis. So let's start with primary biliary cirrhosis. It's an autoimmune disorder, and it's destruction of intrahepatic bile ducts. And if it's an autoimmune disorder, it means females will be more than males. Symptoms are fatigue, pruritus, and jaundice. And also you will see severely elevated alkaline phosphatase and bilirubin. And also you can find anti-mitochondrial antibodies for this condition. So treatment is ursodeoxycholic acid, and for pruritus cholestyramine, and also treatment a liver transplant. Primary sclerosing cholangitis, it's already immune-mediated disorder, and you will see fibrosis and structuring of intra and extrahepatic bile ducts, and it's associated with inflammatory bowel disease and more for ulcerative colitis than Crohn's disease. Symptoms are fatigue, pruritus, and jaundice, like for primary biliary cirrhosis, and like for those that condition also will be elevated alkaline phosphatase and bilirubin, but here you will see also you can find sometimes BNK antibodies, and the most important sign it's beads on a string. You can use MRCP or ERCP. It's endoscopic retrograde cholangiopancreatography, and you will see like this. So it's like beads, like here on a string. So, and treatment, ERCP, or just remove this liver and replace it with a healthy one. Okay, so that's all. So thank you very much for watching, and see you next time.